Hey there. Welcome. It's another episode of the Stories of Gumption podcast coming at you live. Well, not quite live, but you know what I mean. This thing's pre-recorded, but sometimes it feels live, and that's what we love about it. It's authentic. And real conversations with entrepreneurs, creative thinkers, and in my opinion, just really, really impressive people. We are supported by 3 fantastic sponsors. So before we get into this episode today, we're going to talk to you about them. The first one, Sparkle Clean. That's right, SPAR-KIL-KLEEN, Sparkle Clean. They provide professional and economic cleaning solutions to residential and commercial structures. They specialize in window cleaning, floor care, carpet extraction, and auto/boat detailing. That's right, you heard it. They'll do boat detailing and they'll detail your car. So give them a call. Free estimate 518-578-2931. That is 518-578-2931. You can also find them on Facebook. They're on Instagram at Sparkle Clean. That's Zach and Kate Hoyt, everybody. They're local to Champlain Valley. They are great people. I actually met them through the Adirondack Young Professionals, and man, great people, local people. They deserve your business if you have a professional cleaning need. Give them a call. No job too small or too big, I think. I don't know. Give them a call to find out. Sparkle Clean. We are also sponsored by Kavanaugh Realty. You've heard of them before, but if you haven't, they are a local independent real estate company helping their neighbors buy and sell their homes here in the Champlain Valley. They're all over social media. So check them out on their website. Definitely social media, definitely Facebook, Instagram, YouTube. Galen Trombley is heading up that crew, but they got a great crew over there. And man, when you walk in that office and you visit those folks, they are bringing the energy and the positivity. And there are, as I've said in previous podcasts, tons of really great, passionate real estate agents and firms and brokers in our region. We are blessed to have them. They're all doing amazing work, and they're helping to move our area forward. But Kavanaugh Realty is a proud supporter of this podcast, and we're really happy to have them supporting us. Hashtag Local Matters. And our third sponsor, if you've listened to any of these episodes from the Stories of Gumption podcast, you've probably heard of them. They've been along for the ride almost every episode, and their support keeps coming, and we are super grateful for that support. That is Open Gate Farmstead. You've heard the jingle. They're a stone's throw away from the mighty Ausable River. Open Gate Farmstead is a first-generation farm specializing in free-range poultry, pasture-raised pork, and seasonal produce. The farm is run using a simple principle. Happy animals make the healthiest and tastiest product. You're going to find their chickens eating bugs on pasture, their pigs enjoying a mud bath or maybe some acorns, and if you're lucky, the geese will be enjoying that pond. To watch and experience the Open Gate Farmstead journey, you can check them out on YouTube. They're right there. Search it, Open Gate Farmstead. Or you can catch them on Facebook, Instagram. They're all over social media. Check them out and try that farm fresh difference. Oh, again, Open Gate Farmstead, we really appreciate their sponsorship. Today, holy smokes, what a treat. Have you ever thought about how you can be a little bit more meditative, calm, relaxed, reduce your stress, focus on your own mindfulness, your own mental strength? You know, for a long time, I was kind of a suspect. I was like, I don't need that stuff. But I'll tell you what, after my conversation with Dr. Sharon Theroux, I am really reconsidering meditation, mindfulness, and all the positive impacts that it can have on my short-term and long-term life. So, hey, enjoy this episode of the Stories of Gumption podcast. Gumption, defined as initiative, aggressiveness, resourcefulness, courage, spunk, guts, common sense, and shrewdness. Welcome to the podcast. This is Stories of Gumption with your host, Ryan Lee. All right, we're live. I'm very excited. I hope that I'm going to learn something personally, but you as a listener, I hope you get something from this as well. Today's episode is with Dr. Sharon Theroux. She's a neuropsychologist, psychotherapist, certified MBSR instructor, which stands for Mindfulness-Based Stress Reduction. She's the co-founder of South Florida Psychology. She's the founder of South Florida Center for Mindfulness. And if she's not busy enough, she's the co-founder of International Seminars Group. Welcome to the Stories of Gumption podcast, Dr. Sharon Theroux.
Well, thank you, Ryan, and thank you for having me.
Yeah, absolutely. Full transparency out there. We probably should say as well that you are my wonderful wife's aunt.
Mm-hmm. You're my
And
nephew-in-law.
nephew-in-law, you're my aunt-in-law, and I'm super proud to say that because
Me too with you.
yeah, certainly my life is in a net positive because of it.
Well, thank you.
So anyhow, I would love to get right into this thing. I'd love to talk about your story of gumption, learn a little bit more about you and your background. But let's start with what gumption means to you.
Well, that's a very good question, and it's interesting. I never quite thought about the word until you told me that this was going to be a question. So I actually Googled it to find out. And what I came up with from Wikipedia is that gumption is a shrewd or spirited initiative and resourcefulness. And I was like, yeah, that sounds like gumption to me. So, but to me also, I think that gumption oftentimes arises out of something that has been a struggle for someone. So yeah, I think sometimes with gumption, there needs to be a little bit of suffering involved.
Yeah.
Yeah.
I agree. And you know, I love asking that question because although every guest sort of plays with this a similar meaning of gumption, that everybody has their own take on it too, which is I think is why I love the word. It means so much to so many different people. But yeah, I think there's something great about having experiences in your life where you've got to muster a little gumption.
Yes. Yes. And it
Yeah.
helps
So
define you as a human being, these struggles. Yes.
yeah, absolutely, absolutely. So let's talk a little bit about that. So I mean, where'd you grow up? What was your background? And I sort of know this a bit, but for the listeners, tell them a little bit about the upbringing of Sharon Theroux.
Oh, okay. Well, I grew up in a military family. My father was in the Air Force, and I actually lived up in Plattsburgh with my family there. I have one older brother, and I have four. There's four of us sisters, and I'm the oldest of the sisters. And from the time I was pretty much born till the time I was 7, I lived in Plattsburgh on the Air Force Base. And then we got transferred to Orlando, Florida, and I was there until the middle of my junior year in high school. And then the base in Orlando closed, and we had to move back up to Plattsburgh, which was good in a way because it was an area that we knew of and before. But it was a big culture shock for me moving from, Orlando, which had Disney World, very cosmopolitan area, and then moving, and then in the middle of your junior year, to be moving up to, I went to Peru Central School, so it was a
Mm-hmm.
really big culture shock for me. I remember back in the 70s, I was wearing these, pastel blue, powder blue bell bottom, pants with platform shoes, and then going to Peru where, it was a more rural area. I felt like a fish out
Yeah.
of water, but I
Fantastic.
yeah, but I acclimated there pretty well. And I graduated high school there. I went to Clinton Community College there, and I got my associate's degree in nursing, and then moved to Florida to work as a nurse when I was about maybe not long after I got my nursing degree. I moved
Hmm.
down here. So yeah.
What inspired you to go and pursue your nursing degree at Clinton Community? I have to say, there'll be somebody who was on this podcast, episode 2. His name's Steve Frederick. He's a good friend of mine. He's the vice president of institutional advancement. He's got so many great stories
Yes, I
about
think I
the
listened to.
nursing, the nursing program and its impact. And anyhow, I'm just curious, what led you there?
Yeah, it was just a stroke of luck. I was going there in my first year of college, and I didn't really know what I wanted to become. I thought that I was in their recreational leadership program. I thought I was going to be a track coach because I excelled in track when I was in cross country when I was in high school. So I thought I was going to do that, and then I took this biology course by Pat Mack was the teacher. And I swear to God, Ryan, taking that class and listening to biology, it was like food for my soul. This teacher, Pat Mack, was just such a wonderful teacher, and she really ignited in me a passion for the sciences. And so after I took the biology class, I wanted to take her next class, which was anatomy and physiology. And they told me that, oh, that class is closed to the first year nursing students. We're starting up this new nursing program. And they said, but you know what? And this was like in the summer. And they said, 2 people have actually decided not to come here. So if you can get your application in by, Friday morning, this is probably like a Wednesday, we'll take a look at it. And
Oh my God.
I swear to God. So luckily I had a 4.0 average at Clinton. So I applied and I got in. And I was, it was just kismet. I just, can't believe it. And then I am truly grateful to Clinton Community College because I got nursing scholarships. I was able to live in the nurses' dorms. Um, so I really owe a lot to the Clinton Community College, and I'm a contributor to the Clinton Community College Foundation every year because, it uh, it really helped change my life.
Oh my
So
gosh. That's
yeah,
awesome.
yeah,
That's awesome.
yeah. So yeah, it was Pat Mack's class at Clinton Community College in biology that really struck up my interest in science. I just love science. I'm a real geek when it comes to scientists and scientific information and research. And I don't read a lot of novels, but I read a lot of nonfiction brain related research. So I don't know. It's just the way. That's just what I'm interested in, I guess.
What was your first nursing job? So I
Mm.
assume you graduated out of Clinton and you went and got a job right
I
away, or?
I did. I worked at CVPH Medical Center. I started on the night shift on the psychiatric unit. So
Nice.
yeah, I would people as when you're a starting nurse back then anyway. you had to start with the night shift, shift that no one else wanted. And there
Mm.
really wasn't a lot to do on the night shift on the psych unit. The nice thing is about working the on the psych unit is that you could wear regular clothes. So that was kind of nice. But I remember that I used to get people ready for electroconvulsive therapy in the mornings. That was
Oh,
my big
wow.
job, to get them ready for their shock therapy appointments. But but yeah, that was my first job there. It was at CVPH.
Wow. And I assume you did that for a little while, and at some point you pivoted towards the career you're doing now. I'm curious about how that all evolved in your
Ah,
life.
okay. Well, actually, what happened there at CVPH, I was I ended up dating the one of the he was an LPN, a male nurse who worked the same shift
Yep.
as I did, and we started dating, and we dated for a little while, and then it was kind of in the hospital setting, it's a very small world there, and when we broke up, it was really devastating to me, and I personally could not think of I was so brokenhearted after that breakup. I couldn't think of living in the same town, let alone working in the same hospital
Oh,
with
wow.
him.
Yeah.
So because of that, and also I was kind of on the outs with my mother, because she didn't really like the fact that I was dating. And so I was kind of distanced from my family. I was distanced from, my boyfriend when we broke up, and I just got this brand new nursing degree, and I thought, you know what? I can go back to Florida. So
Ooh.
so I packed my bags, and I just moved to Florida. I don't know how I did it. I really don't know how I did it.
I
I
blacked out. That's just
Yeah, it was just I think it was just motivated by shame. I didn't, because I felt like such a failure, and but so it was motivated by that. But I really needed to get away from the small town, and I needed to create my own identity. Um, I
Yeah.
think that, my mother is a very charismatic woman, and I think at the time I wanted to be just like her. But, you can't be just like anybody. You need to find out who you are on your own rights. And so if I hadn't moved away, I don't think that would have ever happened.
Interesting.
So, so yeah, so I moved down to Florida, and then I worked as a nurse in Florida for a while. And then after a few years of living down here, um, I struggled with some depression and some self-esteem issues, and maybe some eating. Not maybe. I struggled with bulimia. So
Mm.
I was having a difficult time, and I think that in my 20s, I think that it was because I was really shy, at that point, and I didn't know very many people here, and I didn't have any family, didn't have any friends, so I felt very lonely, and so I kind of fell into like a slump. And
And how
then
old were you at that time, roughly?
I was about 21.
Okay.
Or
Okay.
no, I'm sorry, about 26. It was 21 when I
Okay.
left Plattsburgh, and then by about 26, it was actually another breakup with a boyfriend that
Oh, those damn boyfriends,
I
man. They're always
know. I know, but you know what? I am so happy that this happened, because
things happen for a reason.
things happen to provide us an opportunity to
I like that.
to
Yeah.
figure
Yeah,
out what we're gonna
exactly.
do.
Exactly.
And at the time when I was this was a guy, I was going out with this guy. He was a local DJ at one of the radio stations, so he was really popular. So when we went out, it was like, we were like, I was like a celebrity
Yeah.
almost going out for.
Yeah.
So for this 3-month period of time, I was on this wild ride, and it was just felt like I was treated like a princess, and flowers coming to my workplace every day. And then so when he when we broke up, again, I was devastated. And then he was the one that told me, he said, you know what? We haven't been going out that long for you to be feeling this bad. I think might, you could probably benefit by seeing a therapist. And I swear to God, Ryan, I was 26 years old. I was a nurse. I never considered the thought of going into therapy. I didn't know what therapy was all
Yeah.
about. I knew, even working on a psych unit, I knew inpatient stuff, so, but when at that moment when he said, I think you should see a therapist, that was probably one of my first, maybe my second moment of gumption. The first one was just
Yeah.
packing up and moving. But the second moment, it was just saying, okay, I can't fix this myself. Let me see if I can find someone who can help me. And so I did. I looked up, I
Wow.
looked up a therapist, and I started down the road, and I met a wonderful therapist, and I started to feel better. And
Wow.
and so what happened with that was, once I started to notice, like, oh wow, I'm not so depressed anymore, I thought, I want to teach people how to do this, to feel better about themselves. So, I thought to myself, okay, let me go back to school, and maybe I can, I only had my associate's degree from Clinton Community, so I was going to
Mm-hmm.
have to get my bachelor's and then maybe get my master's in social work. But a master's degree in social work, I'd be able to see patients because my therapist was a social worker. So I thought, okay.
Mm-hmm.
And I thought, well, maybe I'll be 80 years old by the time I get my degree, but at least I'm going in the right direction,
Yeah.
Um,
Yeah.
so so I got my bachelor's degree, and at the last year that I was getting my bachelor's degree is when I met my husband. And he had just come back from his internship. He was a psychologist, and he had just come back from Yale. He's a smarty pants, that guy.
What a guy.
Yeah, he's so cool. But anyway, when we started dating, I told him that I was applying to such and such a school for social work, and he said, well, you know what? Maybe you should apply to get your PhD in clinical psychology. And I'll tell you something, I never even considered becoming a doctor or a psychologist. I just didn't think I had it in me. I just never considered it. But he,
Yeah.
made me think that, maybe I could do it. So I filled out the applications and I got in. So that's kind of how that happened. Again,
Wow.
it's just timing, that's happened to me. I'm very grateful for all of the experiences in my life, because it's helped me, launch into different aspects of my life that I would have never probably come in contact with.
Yeah.
So,
My wife, your niece Lauren Gagne, has a whiteboard in her office that says, "The grass is always greener where you water it."
mm,
And I think of that, and I think of sort of what you said a little bit earlier. I forget exactly how you said it, but sort of not necessarily things are meant to happen, but
there are
opportunities
opportunities.
are meant to come your way, and it's up to you to decide whether you're going to take that opportunity or not. And it's interesting how the course you had opportunities and you took them. It's
Yeah.
really inspiring. What was it like going through that PhD program?
Mm.
I imagine that required a little bit of gumption.
Yeah, it was pretty tough. I remember statistics being especially tough, and that was in the very first semester of class. And I would come home every night, and I'd be I remember crying, and saying, I don't know if I can do this. And but I just went to tutoring, and I got everything that I needed to do. I first had to stop working. There was no way that I could work. I thought that I could work full time as a nurse while I was going to graduate school. And I was like, no, that's not going to happen. But luckily I was married then. And so I had a wonderful support system to get me through.
Mm.
Although I did work, I created a head trauma study that I was the coordinator for throughout my time there, where we studied head injury and the effects of head injury on um, the brain in people with you know concussions, post concussion syndrome, those kind of things.
Yeah.
So
Yeah.
yeah. So and what was really nice was my 10 years of experience working as a nurse um, really did help me when I was in graduate school, because especially in the field of neuropsychology, I didn't even know there was a field of neuropsychology until I went to graduate school. And basically what neuropsychology is the study of brain behavior relationships. So it's the study of people who have had brain related problems such as head trauma or stroke or dementia. And
Mm.
we would evaluate these people and then see if their performance on memory tests or personality tests, executive tests, if they were significantly lower than I would expect for someone of that age and education. And then if there was a significant drop, was it due to brain fact related problems, or was it maybe emotional related problems? Because sometimes depression can cloud the mind, and you can it looks like it might be a dementia when in fact it's a depression. And if you treat the depression, the memory problems will get better. So there's a
Mm.
really high need for neuropsychological assessments, and also kids, to evaluate them for learning disabilities, autistic spectrum disorders, those kind of things. So it was a nice fit for me, because I had this great um, medical knowledge that I already knew, that people in graduate school had to learn themselves. So I felt like I had to
Mm.
step up. And getting after that one statistics class, I will tell you, I struggled really hard. I ended up, passing that. But then after that, we found out that the instructor that I had, her husband was struggling with Alzheimer's disease, but they let her go because she was just a bad teacher.
Oh,
So
wow.
all the other statistics classes that I had were a breeze, because I had decent teachers. So sometimes when you're in a class and you're struggling, sometimes it's you, but
Yeah.
sometimes it's not.
Yeah. Yeah. No, that's really interesting.
Yeah,
That's interesting.
yeah.
Yeah.
So
Um, so you earn your PhD. That must have been a awesome achievement, that moment. I assume you walked across the stage. You
yes, I
got your
did.
yeah. Yeah. And where did you get your PhD from again?
Nova University down here in Fort Lauderdale, where I live.
Awesome.
Yeah.
Awesome. And at that point in time, was it pretty clear to you exactly what you were going to do and how you're going to leverage that, or did it take a little time to figure out?
Well, I was pretty sure, because I was in uh, a pretty nice place, in contrast to some of my other uh, the other students in my class, because my husband already had an established practice. So I just pretty much walked into his practice.
Oh, perfect.
I still had to find, my own patients and market my own practice for neuropsychology. But yeah, the fact that I already had a place to go was really very helpful to me. So
Hmm.
yeah. But basically what I wanted to do, it was interesting, because originally I wanted to become a therapist to help people with depression. But then I kind of fell into neuropsychology because of my background as being a nurse. So
Hmm.
there are not very many neuropsychologists who are also therapists. They're, with neuropsychology, you're just doing a lot of assessing. You're not really treating people. You're just collecting
Interesting.
data. Whereas with therapy, you're actually developing a relationship with this individual and getting to know them and to help them through so they're kind of like apples and oranges. And I, neuropsychology was never what I really, was hoping and praying to become. I wanted to be a therapist, but I have to tell you, it's really lucrative to be a neuropsychologist because there's just a
Mm.
high demand out there for people who really know what they're doing when it comes to the assessment of people with brain related diseases. So I did a little bit of so I did neuropsychology to kind of put bread on the table, but my real love was being a therapist. So I did both for quite some time.
Hmm. And so now today, uh, you are the certified MBSR instructor, and you have your own practice. You, as we heard in your intro, you are plenty busy. um, w- tell me about kind of what your day to day is like now.
Mhm. Well, I think that I still do a combination of things, but I stopped doing the neuropsychological assessment. And I in the text that you sent me in preparation for this, you asked me to think of some stories of gumption, like maybe where I might have made an unpopular decision, but
Yeah, yeah.
well, letting go of the lucrative neuropsych practice took a lot of gumption for me so that I could focus
Mm.
more on my mindfulness practice. But I think that so to go back a little bit, how I got into founding and creating the South Florida Center for Mindfulness was actually started on, I received something on the neuropsychology listserv that talked about this new evidence-based treatment, group therapy to prevent depression relapse. And it was
Hmm.
called mindfulness-based cognitive therapy. So I
Mm-hmm.
thought, at that time I had done a lot of groups. I was the relapse prevention group leader at the Renfrew Center, which is an eating disorder unit here down in Fort Lauderdale. I really loved doing groups. I feel like a sense of connectedness with a group, a sense of empowerment. I just loved doing groups. So I thought, okay, let me get this book and I'm going to read this book and see if maybe this is something I could do. So I get the book and they say, okay, if you want to teach this class, this is what you talk about in week 1. These are the handouts. This is week 2. And I'm like, oh my God, this is cookbook. I could actually do this. And they said, but then on, I think, page 304 of the book, they said, if you want to really teach this, if you want to teach this program, you have to take a class in MBSR yourself. And MBSR is mindfulness based stress reduction. And I had never heard about MBSR, or mindfulness based stress reduction. So, but I thought, okay, I'll just sign up for the class. So I just Googled MBSR. There must be a class down here in Boca. That's where my office was. And
Mm-hmm. Mm-hmm.
nothing popped up in Google. And I'm like, and this was back in 2011. So for nothing to pop up in Google, it's like, it just wasn't around. And so I go, okay, let me Google MBSR Fort Lauderdale. That's where I live. Nothing popped up. So then I
Oh
finally
boy.
go, okay, MBSR, like South Florida. And finally I found there was a woman that was teaching it in South Miami on a Saturday. It was an 8-week class. And so I thought, okay, well, let me, I just got a new car and I thought, well, it'd be a nice drive on Saturday to get down there. So I signed up. But I'll tell you one thing. I was a little skeptical about taking the class because before you even go for the first class, you have
Right.
you have an interview with the teacher, and the teacher says to you, I just want to let you know that you're going to be asked to dedicate about 45 minutes to an hour of daily home practice throughout the 8 weeks. And you're going to be
Oh,
doing
wow.
like meditation practice. And I was like, oh my God, 45 minutes. I mean, I was lucky enough to be able to do 10 on a guided, meditation. And it's so funny, Ryan, because
Yeah.
I used to teach, not mindfulness based, but I used to teach relax and biofeedback assisted relaxation therapy. And so I would guide these people through these things, and I just couldn't do it myself.
Hmm.
So I thought, well, I don't know if I can do that. And then I said, I don't know. She probably thought I was full of myself. I said, I'm a doctor. I'm really busy. I don't know if I can do this. But she was very kind to me. And she said, I have found that when I practice in the morning, it kind of reboots my brain so that I end up getting done as much as I would have, or if not more, if I had not meditated. So it ends up being a wash. So I thought, okay, well, I'll take a chance. So I signed up for the class. And in the very first class, and I didn't take this class because I wanted stress reduction, remember?
Right.
I just wanted to teach this mindfulness-based cognitive therapy. But oh my God, in the very first class, and we started to settle in and allow our minds to be still, I never realized how anxious I was until I started to slow down.
Yeah.
And then when I started to slow down, it felt so good. I was like, okay, I need to learn how to teach this. And
Yes.
so I took the class. I ended up taking the class not for my practice, but for myself. And then I opened up the South Florida Center for Mindfulness, and I started teaching it to lay people in the community. Um,
Mm-hmm.
but then people like would come that were healthcare providers, and they would say, can we get CEs for this class? And then I remembered that my husband had a CE company back in the 90s, International Seminars Group. Um, and I thought, well, maybe we could resurrect that company and be the CE provider for these mindfulness-based interventions. So that's how International Seminars Group was born, because we now provide continuing education for MBSR, and also the Mindful Self-Compassion class and other workshops to not only our company, the South Florida Center for Mindfulness, but in 25 other places in the United States.
Wow.
So we're
Wow.
nationwide now, and I think that last year we were able, I think 1,000 healthcare providers have taken our mindfulness based classes. So it's very
Hmm.
exciting, very exciting.
That's what gets me to the next section here of this conversation and this episode of Stories of Gumption. I wanna dive into your expertise in this subject, and I want to sort of frame it from a beginner to an average listener. How can they get started, and how can they better understand what it is we're even talking about here? And so I
Mm,
guess I'll start with my first question.
okay.
What really is mindfulness, and the extension, what is meditation?
Okay. Well, the definition of mindfulness that I use is the one that was coined by Dr. John Kabat-Zinn back in 1979 when he created the mindfulness-based stress reduction program. And he says that mindfulness is simply paying attention,
Hmm.
but you're paying attention in a very specific way. So, firstly, you're paying attention on purpose. So, for example, if you say that I just want to spend a couple of minutes focusing in on sounds, it's like you're setting the intention to just pay attention to sounds. So you're paying attention on purpose. You're also paying attention in the present moment. So, say you're sitting and you're deciding to focus in on sounds, and then all of a sudden your mind wanders off to the future. Like, what am I going to have for dinner tonight? You
Mm-hmm.
notice you're like, oh, I'm off in the future, and then you bring yourself back to the present moment. Conversely, you may be sitting focusing on sounds and you think about maybe the argument that you had with your partner before, you came to work this morning, and you say, "Oh, I'm off in the past." And bring yourself back to the present moment. So you're paying attention on purpose in the present moment. And then thirdly, and this is the most challenging for me, the most challenging aspect of mindfulness is that you're paying attention in this open-hearted, curious, non-judgmental way.
Interesting.
Yeah. Now, I don't know about you, but this mind that I have does an awful lot of judging. Um, it's like I say, my brain sometimes is like a lean, mean judging machine, and it's like, and I thought I was the least one of the least judgmental people on the planet until I started practicing meditation. And then I realized all these judgmental thoughts that would just come in and go out just when I'm focusing in on my breath. Um, so, um, so yeah. So when you notice that you're judging and you're sitting there, you're focusing in on sounds, and you notice the mind has wandered, and you say, "Oh, I'm off in the future. Bring it back." Well, if sometimes people will judge themselves harshly for no reason because they're just in the habit of judging themselves harshly. So they'll say, "Oh, that's you idiot. Why did you get distracted? Get back to that breath. You're not doing this right. You're not meditating right." Well, so what you do is you notice the judging, and then you don't judge the judging, and then you come right back to focusing on sounds. So I know there's lots of layers here. But basically, so
Yeah.
mindfulness is being, paying attention on purpose in the present moment and without judgment. So if that's what mindfulness is, well, what is mindful meditation? Well, mindful meditation is a formal practice where we devote however many minutes that you can, whether it be
Mm-hmm.
5 to 10 minutes. I practice 40 minutes a day, um, uh, where you just focus. You allow the focus of your attention to be on something, like whether it be breathing, your body sensations, sounds, maybe your thoughts, and even your emotions, just tracking and monitoring your emotions. And then when your mind wanders back to the past or off to the future, you bring it back. So, in this daily formal meditation practice that you do, it actually helps you to be more mindful throughout the rest of your day.
Interesting.
Yeah. Yeah,
Hmm.
you really it's that formal. A lot of people, can say, "Oh yeah, I just need to be present," but it's like a skill. If you want to be a good tennis player, you've got to practice your swing, right? So
Exactly.
it's the same thing with mindfulness. If you want to be more fully present throughout the day, less reactive, more responsive to whatever happens, then you really got to put your time in on the cushion, or like or in the
Yeah.
chair. So yeah.
Let's talk a little bit more about that. So, I mean, um, I I I've tried meditation, but I don't know. It's interesting. As you're like a total beginner, and this was a few years ago. I haven't done it. I haven't tried recently, but it's hard to know if you're doing it right. You're like,
Hmm.
and maybe that's part of the lack of mindfulness I had because I'm worrying about, am I doing it right? Am I doing it right? And it's like, no,
Mm.
no, I should have brought myself back to just what the focus was. But um, in our example, sounds
Yeah.
but how does someone like me, or I would assume maybe many listeners, start? And how do they attribute it to something where they might feel feel like, oh, I am doing this right because I'm seeing the benefit. You know what I'm
Mm,
trying to say?
yes. Yes. Well, so like let's just use your example that you just said about you've practiced it and you realize you in the practice you said, "Oh, I'm not doing it right." Well, if you being aware of that you had this thought, and I'm going to put your thought in quotes, "I'm not
Mm-hmm.
doing this right." You are aware that that thought just entered into your head. And you just
Mm-hmm.
allow that thought to come in and go out. But most thoughts are not facts.
Mm.
And you can like I can have the craziest thoughts. And what really was liberating for me when I started um, practicing mindfulness is that you are not your thoughts, number one. And thoughts are not always facts. So you can have the thought, quote, "I'm not doing this right." And then just notice that you're having that thought, but without judging it and saying, and as you notice you having these thoughts, you may notice that, you're judging yourself harshly for something that is totally normal for the brain to do. If our
Mm-hmm.
brains didn't wander off to the future or to the past, we'd all be dead by now. Seriously, we need to learn how to multitask. Like think about just the act of breathing. If we had to think about breathing, and we would all be dead. So we have this wonderful the human body is just this magnificent, miraculous organism that does so many different things for us. So when we notice that our mind has wandered, it's just looking out for us. It's trying to take care of us. But in that particular moment, we can tell our mind, well, okay, we don't need to be focused on that right now. Let's come right back. It's sort of like I like to say, like you're trying to train a puppy to stay on its pad, and the
Mm-hmm.
puppy, is going to wander off when and if the puppy wanders off, do you beat up the puppy for wandering off its pad? No, no, you just gently escort him back, and
Mm-hmm.
and
Mm-hmm.
in a non-judgmental way. So that is the practice. Noticing, and that was so liberating for me. And I think as someone who struggled with depression uh, throughout my life, is that I judged myself harshly for many, many things. Some things, I deserved a judgment call on. I shouldn't have done that. But there were other things like judging myself harshly for, the way I'm built.
Mm-hmm.
I don't have any control over that. I have some control, but judging, myself um, for like the mind wanders off and for being distracted. That's just what the mind does. So and
Mm-hmm.
and that was my first practice in working on being less self-critical of myself. and
Mm-hmm.
and I'll tell you, I was in therapy for 3 years to help me with depression and my eating symptoms. And I felt like after those 3 years, I was no longer depressed, which was wonderful. I was really happy about that. But I'm telling you, with the mindfulness practices, I went from being non-depressed to actually being happy.
Wow.
And it's not just me that has experienced this. Like Dan Harris, he's the anchor for ABC News Nightline. He wrote
Yeah.
he wrote the book 10% Happier, and he's got the 10% Happier podcast. And he believes that as a result of his mindful meditation practice, he's 10% happier. And I would say I'm probably 24% happier.
That's
But
awesome.
yeah, yeah, yeah. So so yes, when you have the thought, so just being mindful that you have that thought, um, and put your thought in quotes like, "Oh, I'm not doing this right." Okay, that thought is here. Now let's go back to practicing focusing on sounds and just let it go. And what you're doing is you're cultivating this ability for focused attention,
Yeah.
and that really does help in everyday life, in your conversations with other people. um, when you are working and all of a sudden you get like a chime from, like, you get a text from
Yep.
someone. You can choose. When you're mindful of that, you can choose and you can say, do I really want to take that now, or do I want to finish, instead of just reacting, you know uh, to it without even thinking about it.
I imagine it could also be applied to like maybe fitness goals or dieting goals or something like that too. Like
Mm,
if you're trying to just be more the classic thing, right? That everybody says, "Oh, I don't have the willpower for that."
yes.
But is it the willpower or is it the mindfulness of recognizing what you really want and the reasons why you want it?
Yes. Well, I'm so glad you brought that up, because I also teach an 8-week mindful eating program called Eat for Life, and there's
Mm.
an app out there called Eat Right Now, uh, that I also am a Eat Right Now facilitator for, and it really, when it comes down to food cravings, it's not about willpower. It's about being present, and I will tell you that there's so much neuroscience that is out there right now that shows that we are vulnerable to habitual ways of responding, such as giving into food cravings or smoking or going for a drink or going for some weed or whatever. We're more vulnerable to soothing ourselves when we are on automatic pilot. And the
Mm.
more mindful we can become throughout the day, uh, and the more aware we can be of what our triggers are, and maybe learn how to, once we know that we are triggered, instead of taking a step back and being able to say, okay, what just happened, and why am I walking towards the refrigerator right now? And do I need soothing? And maybe is there another way that I can soothe myself besides using food that might actually work? Like, maybe I need to have
Mm.
a phone call with somebody, who I'm upset about, or you know, maybe there's something that I need to address in an email, or you can see what's triggering you and then create the
Mm.
more wholesome response. But that's the whole wonderful thing about mindfulness, is that it gives you a space between the stimulus, something that triggers you, and a response. So when you have just a couple of seconds to really drop into the body, the moment that something has happened, when your sympathetic nervous system has been activated and you go into
Mhm.
fight or flight
Mhm.
mode, if you can actually take a breath, stop and observe your surroundings, drop into the body. What are the body sensations here? What are my thoughts? What are my feelings? What you're doing is you're collecting data, so that you might be able to respond instead of that typical knee-jerk reaction. And I will tell you one
Mm.
thing, if one thing mindfulness has done for me, has really helped me in my relationship with my husband, because I don't know, in every relationship there's always um, one person who probably is the more reactive one.
Mhm.
And for me, in our relationship, it was always me for the longest time. And so, for example, we would, in the morning, we could be just having a cup of coffee. We're sitting across the bar from each other. And then all of a sudden, he will say something that will make me feel, usually when he puts something on my to do list for the day, that's usually something that kind of gets me,
Yep.
it sparks, I get triggered. And so if I notice, but now I notice when I get triggered, what happens to me in my body is my cheeks get really hot. And now, if I when I notice that in my body, I'm more aware of when I've been activated, I can say, oh, I'm activated. Let me just take a breath, just pause and see what's really going on. And those 2 seconds has really been, life-saving for me. It keeps me from saying things like that I'm going to have to apologize for later, and I hate to
Right.
apologize. So,
Right. Yeah.
so yeah, it's been very, very helpful for me on so many levels, and that's why I was so motivated to create the South Florida Center for Mindfulness, and then also to help these healthcare providers with to prevent burnout. Research has shown that not only will it help prevent burnout, but it will also improve patient satisfaction scores.
Wow.
Yeah, that's crazy, right? Yeah.
Yeah.
Yeah. The patients of mindful minded people um, are more likely to get higher patient satisfaction scores than people who are not highly mindful.
That's
Yeah.
awesome. That's
Yeah.
crazy.
And that's why they're bringing it into the workplace, like
Makes
with,
total sense though.
yeah, like with Google and Aetna. All these companies are bringing these mindfulness based programs into them because they know it also affects their bottom line. Yeah, it helps their employees, but it also helps their bottom line too. So
Hmm.
so yeah, I was teaching mindfulness based stress reduction to nurses at the Memorial Healthcare System down here, which was 5 hospitals down here in South Broward, and it was just such a thrill for me because I wish that I would have had a stress reduction program back when I was a nurse. So I'm happy to be able to do that now for this generation of nurses.
Yeah. That's awesome. It back to the self practice. I mean, if I were to try or a listener were to try giving this a shot and trying to make it a pattern of behavior, is there a recommended amount of time that you should try and meditate each
Mm,
day to get and like also I guess my extension to that too is how do you know when you're done?
mm.
You know what I'm saying? Like if you're trying it out and you're totally brand new to it and you don't the whole thing is a new exploration for you. How do you know when you've done the appropriate amount?
Yeah, good question. Well, for me, what works for me is structure. And I think that what I did when I was first learning how to practice, like I wanted to practice before even taking the 8-week class. So what I did was I listened to some um, some guided meditation practices, and I listened to John Kabat-Zinn's
Mhm.
awareness of breathing meditation, which I'm sure that you could get anywhere. But you can also go to my website at mindfulsouthflorida.com. I have some 10-minute like freebie meditations that you can download and that you can listen to. Awareness of the breathing. I also have a 10-minute body scan. But
Oh, nice.
I would invite people to try 10 minutes. And if they can't do 10 minutes, then maybe 5 minutes, but try the 10 minutes and you will. I know what happened to me is if you are, say, you're in the middle of, you're 5 minutes into a 10-minute meditation, you're going to get thoughts like, oh my God, I gotta answer this email before I forget,
Mhm.
you're going to get
Mhm.
those things. So those thoughts. So just notice, okay, I have that thought. What's going on? What's the feeling associated with that thought? Oh, impatience. Oh, yes, impatience is here. I want to get up right now, And
Yep.
sometimes I will have to actually sit on my hands to keep me, there until the meditation practice is over. But it's a discipline. And
Yeah.
so I would really invite you to try 10 minutes and do 10 minutes for like a week. And if you can do that, then maybe going a little farther, maybe 15 minutes and then 20 minutes. Um, and then see how you feel as a result of doing these practices. But there are other little ways that you can bring mindfulness to everyday life without you
Okay.
having to sit on the cushion.
Yeah.
Um, and I think that the easiest way to be mindful, what really helps for me is if you could pick an activity that you do every day. Like for me, it's brushing my teeth. So
Yep.
when I'm when I get up in the morning and I go into the bathroom, right now I know now to really brush your teeth. When you're brushing your teeth, notice the sensation of the bristles against your gums, against your teeth, and on your tongue. Notice the temperature. I want you to like really drop into the all the senses, the taste of the
Yeah.
toothpaste, the sound of the brushing, the touch of the bristles, and to really drop into the full, using as many senses as you can to to bathe yourself in the experience of brushing your teeth. And same thing like with taking a shower. When you're taking a shower, really kind of close your eyes and see how the temperature of the water feels against your skin. Is it cool? Is it warm? Is it soothing?
Mm.
Um,
Yeah.
and notice the pressure of the water, and is it something that you enjoy? And mindfulness does not have to be something that you enjoy. You can be mindfully present when you're having an argument with someone, as long as you're breathing through it, or when you're in traffic. And that's another place to be really mindfully present, is like
Yeah.
when
Yeah.
you're in a traffic jam, and just to be able to notice, okay, let me practice mindfulness here. How is my breathing? Is my breathing fast? How are my tension levels? Are my hands glued to the steering wheel? Do I have a lot of tension there? Is there tension in my neck? And maybe if I take a deep breath in, can I release some of that tension as I'm sitting here waiting in this traffic jam? Just take a breath. But
Mm.
that's really what mindfulness is.
Yeah.
It's simply being fully present with all of your senses. Because a lot of times we stay in our heads, and we really neglect sensations that are coming at us from our bodies. And our bodies can give us a lot of clues to whether or not we're stressed. And if we can pay attention to those clues, then we can respond to our bodies and take care of our bodies much sooner than had we just keep ignoring those signals.
Yeah. That's awesome. That's amazing to put it into real life examples like that. Out of my own curiosity, before this podcast, I did some brief Google searching just to kind of get some background on the impact of mindfulness and meditation, and I actually found a couple interesting things I'm curious uh, your thoughts on. But two things that really grabbed my attention were one article that said meditation as a treatment for pain.
Yes.
And the other one was it actually showed some data on mindfulness, and in particular meditation, the practice of meditation, protecting the aging brain from decline.
Yes. Yep. I know
So if you could
both of
comment
those.
on both of those things, that would be really interesting to me.
Okay. Well, John Kabat-Zinn, back in 1979, he created the stress reduction program specifically for people with chronic pain. And what he used is, in this 8-week program, we teach mindful meditation. We teach gentle stretching yoga, and we also work on the cultivation of mindful communication skills. And one of the meditation practices that we do is the body scan meditation, where you focus on different parts of the body, sequentially. You start from the toes of the left foot and you go all the way up, down one side of the body and down the other. And you're
Mm-hmm.
really
Mm-hmm.
paying kind attention to all the different sensations of the body. And there will be people like I just started an 8-week class now. We're in week 2, and people have had a week of practicing the body scan, and they will tell you, I struggle with chronic pain. And I noticed when I was paying attention to certain body parts, by paying attention to it, it actually enhanced the pain. I could feel it more because
That's crazy.
I was paying attention to it. And it makes sense, because with mindfulness, the experience is going to be of the experience of whatever you put your attention to is going to be enhanced. So if it's a pleasurable experience, it'll make it more pleasurable. If it's painful, it could make it more painful. But by allowing, what the trick is with the body scan is just allowing the sensation to be there, and practice this beginner's mind as if you had never experienced this particular sensation at all. And you say, oh, okay, so there's something going on in my right shoulder. Well, okay, is it is it more towards my spine, or is it over, more towards the side of my body? Is it, you know, where is it exactly? What are the boundaries? And is it, what kind of a sensation is it? Is it a burning, or is it a sharp pain, or is it a dull ache? It's like we're being scientists and we're exploring the sensation. What's
Mm-hmm.
and by applying what we call this beginner's mind to the sensation of pain, and not feeding the thoughts that are associated with it. See, that's where we run into trouble with chronic pain, is that when we get a pain, um, we can't help that we have the pain. It's just there. But say, you get pain in your right knee, you may
Yeah.
now you can go down a bad road of thinking, oh my God, my knee's hurting me now. That's where I had, my surgery before. Am I going to need surgery? Maybe I'm going to need a knee replacement. And oh my God, I have to go on this run,
Yep.
in a couple days. What am I going to do? Am I going to be able to run? And your mind just goes off to the races. And what you're doing is, with those thoughts, it's actually activating sympathetic nervous system, activating the sympathetic nervous system, which isn't going to increase your pain. So
Wow.
if you can remove, you notice the thoughts when you're practicing the body scan, and you're focusing on that knee, you just play with the sensations. You just, explore, like, what are its boundaries on a scale of 1 to 10? What is it right now? And, you're just analyzing it, but not feeding the thoughts or the
Yeah.
emotions. You may notice the thoughts that are there. Oh, I'm worried about that race on Saturday. Okay, noticing worry, letting worry go out, and go right back on to focusing on the pure sensation. And what many people
Mm.
find is, when you just focus on the pure sensation, it goes away. Not all the time, but it tends to loosen, because you're not,
That's wild.
it is, because you're not adding this catastrophic thinking to it. You're not adding insult to injury with your catastrophic thoughts or your worries about the sensation. So it's just allowing the sensation to be there, letting it, not letting it do what it does.
Mm-hmm.
And hands down, in the 30 years that the mindfulness-based stress reduction program has been out, the research, have been several meta-analyses. Like, these are studies that look at, like, hundreds of studies. Each study looks at hundreds of studies, and they have shown that unequivocally, mindfulness-based stress reduction helps people with chronic pain, depression, and anxiety. It also helps a lot of other, like ADHD and, Crohn's disease. But
Wow.
the overarching evidence over and over again says it's very effective for chronic pain, depression, and anxiety. And you're focusing right in on, you're doing a body scan meditation. We focus and pay attention to the sensations, but we just focus on the sensations themselves. And if thoughts or
Yeah.
emotions come in, we notice the thoughts or the emotions, but we don't get stuck in them. We go back to exploring the sensations.
Wow. Yeah, and so tell me more. That's amazing. That's
It
crazy to
is.
me. I can think of so many people that I know just within my sphere, and at times, including myself, where you have some pain and you talk about it with your friends and family or whoever, uh, but to leverage uh, the benefits of meditation, and mindfulness around that pain,
It's
not to
something.
ignore it when it's serious and you need additional help, but to recognize when maybe it's not as bad as your mind is letting it become.
Right. And maybe there is something you can do to help.
Hmm. What about that piece about it protecting? an aging brain from
Yeah.
decline.
Yeah, it's very interesting. And as a neuropsychologist, I was really excited to read that article. And basically, if I remember it correctly, well, we all know that after a certain age, our brains start to decline, and everybody's brain declines with age. That's why we notice that we have more
Certainly.
memory problems as we age. So what they did some studies with people who um, were just normal individuals. They didn't have a dementia, but they were just healthy people in their 60s and their 70s, and they gave them these neuropsychological tests before they had two groups. One group, I believe, did an 8-week mindfulness-based stress reduction class, and the other group was like a waitlist control. And they looked at their brains, and they also gave them some memory tests before and then after the 8 weeks. And I also believe they did like a 6-month or a 1-year follow-up. And they found that the people who had taken the stress reduction program, there was the absence of age-related cognitive decline. It's not like their memories improved. It didn't
Sure.
it didn't decay the way their the control group had. And that is just I mean, that is just phenomenal. And I really,
Yeah, that's amazing.
as a neuropsychologist, I think I know how that happens. And there's a lot of research that shows that with a meditation practice, a lot of um, research in the field of contemplative neuroscience. So they look at the brains of people who meditate regularly, and they found that those people who meditate regularly, even people who have graduated from an 8-week course in MBSR, you can actually see brain changes. You see increased gray matter.
Really?
Yeah, absolutely. Yes.
Wow.
Yeah, Britta Hosel and Associates, they out of Harvard, they found that you get increased gray matter density in those regions of the brain that are responsible for attention, concentration, and emotional regulation. And
Wow.
it's the hippocampus, it's the insular cortex, and it's the dorsolateral prefrontal cortex. And as a neuropsychologist, and this is what geeks me out, because I'm just so excited because I know what part of the brain that is. It's the dorsolateral prefrontal cortex. It's right, on the sides of our brain, right by our temples. Um,
Mm-hmm.
that part of the brain is responsible for impulse control, planning, problem solving, that what we call executive abilities. So it makes sense that if you can increase the gray matter density through the practice of mindful meditation, your executive abilities are going to improve, and you're going to be less vulnerable to the cognitive decline that you see in people who don't practice meditation. So I foresee that in the next, I would say, maybe 25 years, meditation will be just as popular as running, or going to the gym. Um,
Yeah.
and my hope is that
Yeah.
they will be places in the gym for people to go exercise, and then they can go meditate afterwards. But, because it'll just be, it's just normal hygiene to be able to meditate.
Yeah.
But we'll
That's
see.
awesome. Oh man, this has been such a good conversation, and I got out of it what I was hoping to get. So I'm certainly going to start
Oh,
practicing, and I'll report back.
yeah.
I'll let you know.
Yeah, listen to
And
my
it
meditations.
yeah, yeah, and I'll put that link in the podcast too, if you're okay with that, and so people can check it out and all that. But I'd like to pivot to the stories of gumption rapid fire
Ooh,
section.
okay.
Are you are you ready?
I'm ready.
This part's fun.
Okay.
So, couple handful of very quick questions here. I ask pretty much. I have a list of probably 10 questions that I pick from, and I rifle them off at the end to sort of close out each episode. And the first one, are you ready?
I'm ready.
What's a book that you would gift to a friend, and why?
Okay. Well, I have gifted this book to many people. It's written by John Kabat-Zinn, and it's called "Wherever You Go, There You Are." and and I recommend it
Nice.
because each there's a little page or two that he talks about different things, like non-judging or letting go or beginner's mind. And it's just like a page or two that kind of lets you drop into and learn a little bit more about mindfulness. So you can take bite-sized morsels of mindfulness in that way.
Yeah. Wherever you go, there you are.
Yes.
Or, okay. Wherever you go, there you are. I like it.
Yeah.
Here's a fun one. Question number 2. If you could have a billboard anywhere in the world, what would you put on that billboard and why?
Oh, I love this one. And this came to me really quickly, because I give this out to, I put this on bracelets and I send it to my friends.
Oh,
Um,
perfect.
yeah, and this is a saying. I think it was created by Thich Nhat Hanh. He's a Buddhist monk, and
Uh-huh.
and the saying is, "No mud, no lotus." Have you ever heard of that?
I have heard that, but admittedly, my naivety, I feel like I need you to explain it for me.
Okay. All right. Well, I didn't know about this until just a few years ago. But
I feel
according
like I have heard that before, but yeah, please
so
explain.
so according to folklore, I guess, or I don't know if it's the truth or not, but I just love the saying anyway. The lotus flower can only bloom when it's growing in the mud.
Interesting.
So to me, and this has pretty much been, the mantra of my life, is that, I I grow from adversity. I need to, if I didn't have the mud in my life, I would not have grown into the person that I am now. And
Yeah.
in the future, when I come across some mud, I will hopefully remind myself, no mud, no lotus. And it might help me stay in the mud as long as I need to be until, I learn something and can move on. Yeah.
That's fantastic.
Yeah.
Can I put in an order for a couple of those bracelets?
Yeah.
That's awesome.
All right.
No, I like that a lot.
Yeah.
Question number 3. What's a piece of advice, if you could go back in time, that you would give to your 18-year-old self?
Mm. That was a really good one. And it's so funny. What I ended up with was actually posted on my wall when I was 18 years old. But I knew in my head, this advice, but I didn't feel it in my bones. And
Mm,
and it's a piece from the Desiderata. Are you familiar with that?
mm-mm.
Okay, it's a poem that was, or a writing that was written in 1927 by Max Ehrmann, and it's a wonderful, wonderful poem. But in the um, one piece of the poem says, "You are a child of the universe, no less than the trees and the stars. You have a right to be here. And whether or not it is clear to you, no doubt the universe is unfolding as it should." So,
Wow.
yeah. So to me, that helps me feel like I'm no less than the trees and the stars. I'm no less than any other person on this planet. I have a right to be here, and whatever is happening in this life right now, it's things are unfolding as it should, and to just try to be the best person that I can be and just hang on.
Yeah. Yeah, and who knows where we'd be and what we'd be talking about on the podcast today if you hadn't taken that biology class and then
Yes,
applied for the nursing program at Clinton Community. That's so
absolutely.
cool.
Yes. Hmm.
um, Question number 4. This is my favorite question. If we could assemble a 3-person board of directors to guide and mentor you through the rest of your life, who would those 3 people be that you would select? They can be alive, deceased, famous, or not. But who would your 3 people be on your personal board of directors and why?
Okay. Well, I think first I would definitely have Thich Nhat Hanh, the Vietnamese Buddhist monk who was nominated for a Nobel Peace Prize by Martin Luther King Jr. Actually, he's just such a wonderful role model for compassion. So he would be on there, um,
I
and
like it.
then the second one would be Cat Stevens. Or I'm sorry, what's his name now? Yusef. Oh God, I can't remember what his Muslim name is now.
Yeah.
Something Yusef. Um, but anyway, Cat Stevens,
Yeah. Cat
because
Stevens.
because throughout my life, and even today, his songs have really helped soothe me and guide me and direct me. So he would be a good one on my board of directors, I would think. Um,
Nice.
and then third on my board of directors, and I can have anyone who I want, right?
Anyone.
Okay, Oprah Winfrey.
Oh, there you go.
And I would want her to be on my board of directors because she is hugely successful in my mind because you know because she's just herself and she allows herself to be vulnerable, and seeing her vulnerability has really, and I see that as a strength when we can really talk about our vulnerabilities, and to be able to do that, I really admire her for that. So she would be my third member.
Mm, I like it.
Hmm.
I like it.
Hmm.
This has been a fantastic conversation, Sharon. Thank you so much for giving me and the listeners some of your valuable time.
You're welcome.
Um, I'd like to give you an opportunity to give a sending message, whatever you like. It can be um, about your business, how they can get in touch with you, a sending message on mindfulness, maybe both. But I'd love to give you an opportunity to share that.
Great, thank you. Okay, so if you are interested in practicing some mindful meditation practices, you can always go to my website, which is www.mindfulsouthflorida, all spelled out.com. And you go to the resources section and then pick meditations. And I think you'll see about 4 different meditations there. I also do some online mindful coaching, and you can send me an email at drtheroux, Theroux, at comcast.net, or you can call our office at 561-395-0243. I use the Zoom platform for mindful coaching, and we also do corporate workshops. And I'm now doing national workshops, all day workshops in mindful eating. I have a workshop, Your Brain on Mindfulness, that explains in much more detail what goes on with the brain when you're practicing mindfulness. And yeah, that's how you can reach us. And hopefully, we'll be doing 8-week courses in mindfulness-based stress reduction up in the North Country sometime real soon.
That's awesome. Awesome. Well, thank you so much again. And I'm sure I'll be seeing you around. But thank you. Thank you so much. I've gained a lot from this conversation. I'm sure the listeners have gained a lot from this conversation, and it's greatly appreciated. Thank you so much.
Well, thank you, Ryan. Take care.
Well, everybody, until next time, this is Stories of Gumption. podcast. Thank you for tuning in. Thank you for sticking around, and enjoy the rest of your day. Thank you.